Okay.
I'm Dannick Boutin. First, let me apologize for my accent. I've been in the U.S. for 15 years, but I still haven't gotten rid of my French-Canadian accent. So if there's any time where you can't understand what I say, just make big signs. And I'll stop and try to repeat slower. I'm Dannick. I've been at Margaret Teats Nursing and Rehabilitation Centers about 10 minutes from here for over 10 years. We're a subacute rehab. That means that we see people after they've been in the hospital, typically anywhere from 10 days to 6, 8, 10, 12 weeks, depending on what their ailments are. In the case of joint replacements, and I'll speak a little bit about knee replacement as I just outlined, but I'll go into hip replacements as well, because that's also probably the second biggest replacement that we see. It's a pretty big part of the type of people that we see there at Margaret Teats and most rehabilitation. So I'll go over, they did a great job in explaining how you get to a knee replacement and what gets done. What to expect after a joint replacement. I'm always careful to come up with, you'll be there in 10 days, you'll be there in 20 days, you'll be there in 30 days, because I don't know that there's such a thing as a typical patient. Everybody's different. Some people take a little bit longer, some people take a little bit less time. It really depends, every person is different. What's going to determine that is obviously the higher level of function you are before the surgery, the most likely you are to recover quicker. The comorbidities, if you don't have any cardiac history, if you don't have any, if everything else goes well, you're also more likely to be able to do more therapy quicker and recover quicker. So everybody takes different time frames to recover from a joint surgery, and everybody will go back at different level of function. But I'll give you a bit of an idea of what to expect, and once again, it's to take with a grain of salt because everybody kind of moves at different speeds. Typically, what you're going to do in therapy within the first day, as Doctor mentioned, they're going to mobilize you right away, whether it's the day of surgery or the next day. Get you on your feet, get you walking, with a walker, so you can get some weight off the leg, so you don't have to put full weight on the leg, and with a therapist with you. But you're going to get on your feet right away. From the first day to the third to fourth day after surgery, a lot of modalities to try to decrease the swelling. There's a lot of swelling, so we'll do ice. And ice will keep going on for the first 2 to 3 weeks after surgery. If you're in our facility, we'll do ice every day, 2 to 3 times a day to try to get the swelling down. Pain control is very important as well, both with medication and ice helps as well with the pain control. Getting the range of motion. Because of the swelling, because of the surgery, it's very difficult to bend the knee. So the therapist will focus on that a lot in the first week, try to get that knee to bend. What we try to achieve before you go back home is to get to knee at least 90 degrees, to be able to go to 90 degrees like this. And that's a lot on the patient as well, because as much as the therapist can work with a patient for an hour a day, 2 hours a day, there's still 22 hours to be done. So if you don't move your knee for the other 22 hours, you're likely to get stiff. So it's very, very important that you work with the therapist and by yourself to keep the motion going in the knee. Physical therapists also will obviously work on walking and on making sure that you can walk with the walker and eventually progress to a cane, progress to nothing. Once again, how you were walking before will also affect how quickly you're going to recover and where you're going to get. We see some patients that for years had limps because of the pain. So you had some atrophy in the muscles, you had sometimes shortening of the muscles, so it's much longer to try to achieve a gait that's more normal. If someone had the surgery fairly quickly in their disease process and they were pretty good, usually you can go up much quicker as far as the recovery. So for a knee replacement, and you'll see, and maybe they have a better idea as far as percentage, but there's a fairly big percentage of knee replacement that will go straight home after the surgery. So they're 3 days in the hospital, they'll go straight home and do their therapy, go to an outpatient clinic and do their therapy there. But there's also a percentage of them that require too much assistance, they're not ready to go home yet, they may not have family at home, so then they would come to a rehab center where they'll get therapy on a daily basis and get their nursing care. Typically, the stays in a rehab center can be anywhere from 7 days to 21 days, to a little bit longer if there's other things that happened in the meantime. But between 7 and 21 is the majority of knee replacement will stay in a rehab facility. Occupational therapy will also see the knee replacement patients or the joint replacement patients. The occupational therapist's point of view is try to help you for those first 2 or 3 weeks when you can't bend as much, where you can't do for yourself. They'll show you different techniques. I brought some props. They'll give you different equipment that can also help you function if you don't have full range of motion, both at the knee or at the hip if you have a hip surgery. So different things can be very useful. This here is called a sock aid. If you're not able to bend enough to put your socks on, it's a very simple thing. You can use this. You put a sock right in here. You use the strings. You drop it on the floor. You put your foot in and you pull it up and your sock is on. So that's used not so much in knee replacement surgery, a lot more in hip replacement surgery because of the hip precautions, and I'll go over that a little bit later. So that's a very easy example of what the occupational therapy can do with you. They're going to work on showing you how that works. Give you a reacher like this, so you can reach for things on the floor or things that you cannot reach during the time that your range of motion is not as good. Dressing stick, same principle. The hook over here is to put your pants on. You're going to drop it, put your foot in, bring it up, catch it, and then be able to dress yourself. So simple things that the occupational therapist can help you with to help you recover and help you be able to take care of yourself while you recover. With the joint replacement, the goal is for at the end of this to be better than you were before. No pain, more mobility, and be able to function by yourself. But in the meantime, those little things can be very helpful. Hip replacement. Let's go over hip replacement a little bit. Hip replacement. It's a little more complex as far as there's a few little things to consider when you do your rehabilitation. Because the hip joint is a ball and socket joint, and what holds the hip in the joint, a lot of it is the muscle strength. So when they do the surgery, they have to cut through those muscles for a little bit. There's a little bit more weakness. So there's some what they call the hip precautions. There's some movements that the doctors will not want you to do for the next 8 to 10 weeks after the surgery. Simple movements. They won't want you to bend your hip more than 90 degrees. So that means you're not going to be allowed to go and touch your foot for 6 to 8 weeks. So that's where that type of equipment can be helpful. They're not going to want you to cross your leg for a few weeks to avoid the dislocation. So that's the type of thing that the therapist will go over with you and show you how to do what you're supposed to be doing without doing those movements. The recovery of a hip replacement is fairly similar as far as time frame. Typically, you'll be in a rehab center about 7 to 21 days, and you can continue your therapy at home after that. As far as doctor mentioned 9 to 12 months to get back to a good recovery, but I would say that within the first 3 months is definitely where most of the recovery will happen. Most of our patients at the end of their 3 months are back to walking close to their level as they were before. So if they used a cane before, they would be back on the cane. If they didn't use anything, they would be back to where they were before, and sometimes even better. Within the first 3 months is usually when most patients recover and get back to their level. Other types of joint replacements that we see, and the doctors could probably, we see shoulder replacements. It's much less frequent, but that's also a type of replacements that we see. I believe they do ankle replacements as well. Also much less frequent, but we see that as well. That's pretty much it. Any questions? Anything?
Any questions?